Welcome. My name is Cheryl Osborne, Musculoskeletal Injury Prevention Advisor with Workplace NL, and I'll be facilitating this session titled, Is Poor Posture Affecting Your Health? For short, musculoskeletal injuries is referred to as MSIs, and today you will hear me use that abbreviation. One of the side effects of the COVID-19 pandemic is a global change in work ergonomic patterns as millions of people replaced their usual work environment with home to limit the spread of the virus. The primary computer was a laptop, and many didn't have the furniture and accessories to set it up in an ergonomic manner. The result was exposure to awkward postures and often for prolonged periods, and other factors that contribute to the development of MSIs, such as repetitive motions. For some others here today, the pandemic may not have had anything to do with how you feel. I have seen some pretty horrendous office setups in my years in the field as well. And then there's those of you who may not be in an office type occupation at all. Maybe you work on a processing line or in the bowels of a ship, or you drive for a living. No matter the setting where you work, the principles are the same. Regular or prolonged exposure to poor posture can affect your health. Poor posture is often the result of a mismatch between you, the worker, and your body size and needs, and that of the design of the work area or station in which you work. And sometimes personal factors might contribute to how you feel as well. And here I'm referring to our choice of posture. And sometimes this comes down to lack of education and just not understanding the consequences of poor posture. So before we dive in, I just want to encourage everyone in the session to stand up and move around at any point throughout the presentation to get your blood flowing and prevent or alleviate any discomfort that you might feel. Musculoskeletal injuries, or soft tissue injuries, they're also called, they account for 2/3 of all lost time injuries in Newfoundland and Labrador workplaces. In every individual, every day, individuals are exposed to MSI risk factors. So this session will discuss and demonstrate proper body mechanics and practical solutions for reducing the risk of musculoskeletal injuries in the office, when working from home, or in any other setting. But primarily we will focus on computer type work today and other seated type work. So today's learning topics will be about pandemic posture and the MSI risk factors, relevant signs and symptoms of MSI associated with working from home or anywhere remotely using computer devices, and we'll talk about some prevention measures. And by the end of this session today, you're going to be able to demonstrate good, which is protective or healthy posture when performing computer or desk type work, whether you're sitting or standing. You'll be able to implement tricks in the interim until a better setup might be attained if you don't currently have the setup needed to be able to make your home office or your current station, wherever that may be, a better one with less hazards and one that's able to get you more comfortable. So we're going to look at a few tricks that can be applied to your workstation, perhaps right now in the interim until a better setup is achieved, or better furniture and equipment. So this might be, things that can be used in a hotel room or other remote locations. You're going to know how to organize your work to build movement into your day, and you'll be able to perform some tension breaker exercises, such as stretches for common problem areas where we experience tension from prolonged seated and computer type work. And we'll also learn a few other tips, such as belly breathing, to relieve both physical and mental stress. So pandemic posture. This refers to poor posture from slouching at a desk or on a couch during our time at home. And it brings lots of, back pain and complaints of neck and shoulder issues. So what it is that essentially during the COVID-19 pandemic, people have been spending a long period of time in these very poor setups to do their work, and there was often a lot of distractions in the home environment where we had perhaps children or other loved ones that we might have been caring for at the time who were home due to the pandemic. And the spin-off of that was that, when we were able to do our work, then we often spent long periods of time when we didn't have those distractions. And so sometimes we spent too long periods of time doing our work without regular changes in posture. And if we didn't have the ideal setup at the start, likely we had awkward postures that were then held for prolonged periods. So when it comes to the MSI risk factors, using a laptop is never an ideal situation. They're great for portability. They allowed us to be able to remain working during the pandemic, but the unfortunate piece is that they do force us to work in awkward postures if a laptop is used in and of itself without any external accessories or devices to be able to use with it. And if we don't have the proper furniture to sit the laptop on or sit our bodies in. And this was certainly the case during the pandemic for many people. So as a result, what's happening is that workers were exposed to awkward postures, sustained postures, and repetitive motion. Some signs and symptoms. The signs and symptoms of MSI are not the same for every disorder or condition. There's many different signs and symptoms, and they can range from minor discomfort or severe pain. During the pandemic, when working from home, likely the symptoms or the signs started off as minor and then they progressively worsened. Signs and symptoms may present immediately as a result of an acute injury, but here we're talking about more so the situation where symptoms develop gradually and then it can lead into a chronic condition and a more serious or severe condition that may be more complex. There's more damage happening and then maybe more therapy that may be needed to be able to recover from the particular damage that's being done or that was done. So some common signs and symptoms that we would be looking out for or that we may have felt during the pandemic, or we might feel just from the type of work that we do, not specifically related to the pandemic, but office type work, computer type work, where we're seated for long periods of time. So pain, aches, tenderness, soreness, or discomfort that persists day to day or interferes with activities of work or daily living. Weakness, tightness, stiffness, redness, swelling, reduced range of motion, numbness, shooting or burning sensations, or just general feelings of fatigue. Some disorders fit established diagnostic criteria, such as maybe carpal tunnel syndrome or tendonitis, for example, but other musculoskeletal injuries or disorders, they may be manifested by non-specific pain. Some transient discomfort can be a normal consequence of work, but discomfort that persists from day to day or interferes with activities of work or daily living should not be considered to be an acceptable outcome of work. And by legislation, workers are to be educated about the signs and symptoms of MSI so that they can recognize early when one may be developing. That's very important because if we can recognize early before too much damage is done, we have a better chance of being able to recover those, or reverse, I should say, those signs and symptoms, and hopefully reverse any damage that may be happening and prevent any permanent damage from developing. So why does poor posture cause back pain? Holding any posture for a long period of time, whether it's sitting or standing, sometimes increases discomfort because of muscle spasms or muscle fatigue. Having poor posture may also put increased pressure on certain joints or produce an imbalance on one side of your body that bears an increased load compared to the opposite side. And this can lead to various muscle imbalances. Poor posture can also result in nerve irritation at pressure points, such as the buttocks or tailbone, which can be painful. If you look at the image here, this is probably a posture that we're all fairly familiar with and we all use from time to time. The legs are crossed on this particular person. They're not using a footrest. There's increased load on the right side of their body due to the way that the person is seated at the desk here or the table. There's poor back support. The worker has a C-shaped spine as opposed to the more natural S-shaped spine. and the table is too high, and that's resulting in the upper back and the neck and shoulders bearing a fair bit of muscle strain or extra stress on these particular tissues, which can lead to fatigue and progressively lead to those signs and symptoms discussed just now. My apologies, I forgot to switch the slide here. So this is the picture I was referring to with the C-shaped spine, and the person is not directly, facing the table and has a pretty poor posture with no stool, legs crossed, so there's blood circulation trouble happening here, restriction of proper blood flow in the lower extremity, neck bent down, so the upper back tissues, neck tissue, shoulder tissues being impacted here as well. In regards to the neck and the shoulder, this is a common site or location where workers who work at a computer or work in a seated position for a prolonged period of time doing work at a table or some kind of a bench. This is the common location where discomfort is experienced. Muscle fatigue, tension or pain, stiffness, muscle imbalances can occur, and even tension on nerves, particularly if a poor posture is used. And sometimes what it is that we may start off with a good healthy posture, but with time, spending too much time in the chair without getting up and having a change in posture, the tissues are becoming fatigued, so we start to compensate for that, and then we start to slump forward in our chair or move around in the chair because we're getting uncomfortable, and then the other tissues start to suffer, like the neck and the shoulders, because they tend to come forward in that like gooseneck posture, and so the tissues start to suffer. Prior to the onset of the COVID-19 pandemic, less than half of Canadian adults were meeting the physical activity recommendations of 150 minutes of moderate to vigorous physical activity per week. And now Statistics Canada has reported that since the start of the COVID pandemic, adults have decreased their level of physical activity even more and increased the amount of time sitting. And the act of sitting for too much, basically too long over the course of a day, day in, day out, and sitting for too long of a period of time without a change of posture has many health effects, such as some of the effects that you see on the slide here. The benefits of physical activity are well known, include things like lowering the risk of death and the risk of developing cardiovascular disease, like heart disease and stroke, diabetes, depression, anxiety, dementia, several types of cancers, and other conditions, as well as several MSIs. So therefore, it can be extrapolated that increased sitting time can negatively impact one's overall health. So I would just like you to pause for a moment and self-reflect. Is pandemic posture, or just poor posture in general, not even necessarily related to the pandemic and any change in your work activities, is poor posture in general affecting your health? And if it is, why do you think that might be so? What are the factors that may be contributing to your signs or symptoms or discomfort? Is it the posture that you're working in? Is it the fact that you sit for too long periods of time? Is it a combination of both? What do you think some of the reasons might be? And what can we do about it? You know, is it too late? Are we gone beyond the point of return? Well, one thing is for sure, and that is if we continue to do what we're doing, the damage is only going to worsen, and injury may become severe or more severe and could even become debilitating and affect your ability to remain at work over time. So we do need to, if we know that we're exposed to these MSI risk factors, we do need to do something to try and reduce our risks moving forward, so that hopefully we can reverse the signs and symptoms and it's not too late. But at the very least, we can maintain our level that we're at right now, and perhaps with potentially even some therapy or some exercises, which I'm going to talk about later. I have some suggestions on personal postural exercises and tension breaker stretches and things that we can do. And if we incorporate some of these tips and prevention measures, that we can hopefully see some reversal in the discomfort or symptoms that you may be experiencing. So I'm going to talk now about the prevention piece, and we're going to focus specifically on 6 tips or 6 measures, prevention measures, to help reduce your risk of experiencing any of the signs and symptoms as discussed earlier, or to alleviate any that you currently are experiencing. And the key really with this picture, I guess the meaning or the message behind that picture is that the real key is that we need to put our health, our personal health and wellness first and foremost, and not the other way around, not work first, not money first, because without our health, work becomes impacted too. We may not be able to effectively, be productive when we're in the workplace. You've probably heard of the term presenteeism. You're there, but you're not really there. The work output is not as effective. Or perhaps down the road, you may not even be able to conduct your regular duties due to the severity of signs and symptoms if we just don't address things soon. All right, so we're going to start off with posture. And the fact that we need to potentially improve our posture, or at least we should be educated on what neutral posture is and assess whether or not we do tend to use a good healthy posture in our day-to-day throughout our workday. And if we don't, if we're pretty far from this neutral posture, we need to look at ways that we can get ourselves back closer to the neutral posture. So when you look at this picture here, what you're seeing is that the person has a nice natural S-shaped curvature maintained in their spine. So they have a nice upright body. Their upper body is straight up, so vertical or slightly reclined, but there's some back support to be able to accommodate that natural S-shaped curvature. And then we have a roughly 90-degree angle at our elbows as well as at our knees. And the feet are firmly supported on a solid structure such as the floor, or it can be a footrest. And then our wrists are straight with a nice, there's no bend in the wrist. The wrists aren't bent down or back or side bent. The wrists are able to remain straight so that we can reduce our risk of things like carpal tunnel syndrome or tendonitis. So now we're going to look at the key features to look for in a chair, or just really to assess the types of adjustment features that are available on chairs in the market today to be able to help individuals get to this neutral posture. And the key message is that one chair does not fit all, because as human beings, although all of us relatively look similar, we are different in regards to specific measurements of body segments. So some of us have longer arms than others, and as a result of that, a particular height for an armrest may not be suitable for one worker where it may be suitable for another. The width between the armrests may not be suitable for one individual compared to another. The height of the chair may not be appropriate for one individual compared to another. Generally, females tend to need to raise their chair higher if they have a fixed workstation desk, and they can't adjust the height of their desk, because in general, the average female is shorter than the average male, and the height of standard desks are too high for many females. So we'll talk a little bit more of that now when I show you some of the features available on chairs and show you how to adjust to neutral posture. So just bear with me. I'm going to turn on the camera. Okay. So hopefully you can see me pretty good here in my chair. All right, so what you want to do to adjust the chair, and actually first I'll just mention that the picture on the screen is a snapshot of a safety share that Workplace ML has on our website. It's called Sitting Position, so you may be interested in downloading that at a later time. So I'll just walk through the instructions on how to adjust your chair, and in doing so, then you'll start to understand some of the adjustment features that are available to look for. So you want to, actually there's a few different ways that you can adjust your body to sit in neutral posture, but my recommendation would be to start with your feet and work your way up the body, and then take care of your arms after that. So let's just start with your feet. They need to be fully supported on the floor or a footrest, as I had mentioned, but we'll start off always with the floor. And later when we introduce our chair to our desk, now that we have the chair set up for neutral posture for us and for our bodies, then if there's a mismatch between the height of the desk and the height of the chair, or the height of the armrests, then we may need to adjust the height of the seat and use a footrest, but I'll get to that. So let's start with our feet on the floor. And if you're sitting at a chair right now, I encourage you to kind of follow along with me, and you can make some adjustments as we go along. So you want to have about a 90-degree angle at your knees. And if you use a footrest, your knees may be opened up more, and that's fine too. But from the floor, basically about a 90-degree angle. You want to have some space behind the back of your knees. They recommend at least a couple of fingers or a clenched fist behind the back of your knees. So that allows for better circulation of your blood vessels and also for your nerves. So some chairs come with the ability to adjust the depth of your seat pan, and often you'll find that adjustment feature on the front, coming across the front underneath your seat. There's a bar that you can pull up on or pull out, and you grab that thing and you sort of bring your back into the backrest of your chair. That's the key. You want to have your back into the backrest of your chair, and then you can adjust the depth of your seat pan, okay? So it's the proper depth when your back is into the backrest, and then you have that slight gap at the front behind your knees. So some chairs have the ability to adjust the depth and others don't, okay? And of course, you get what you pay for the most part. With the backrest, actually, I should mention too, with the seat, we want to be able to make sure that it's the proper height for us. So to be able to have that 90-degree angle at the knees, you're adjusting the seat pan accordingly. And typically the adjustment feature for adjusting the seat is on the right side underneath the seat. And for me, it's a lever that I pull up on, and I can adjust the height accordingly. So it's the proper height when you don't have, like this wouldn't be a good height because my feet are dangling, and now I have a lot of compression against the underside of my leg, and that can interfere with blood flow. So it's the right height when my feet are firmly supported on the floor, and I don't have too much compression against the back of my knees. Now with the backrest, there's two pieces that you want to look for. You want to be able to have your back vertical, so there's a 90-degree hip angle, or a slightly more opened hip angle so that you're slightly reclined in your chair. And the second piece is your lumbar support. So that's the hump in the lower part of your backrest. That is called your lumbar support, and it should sit nice and flush against the curve of your low back. There shouldn't be any space in between, and it should just nice, fit the contour of your back. So some chairs have the ability to adjust the height of the lumbar support. Sometimes there's a lever on the sides of the backrest. There's many different ways that you can find lumbar adjustment features in a chair. There's so many different chairs and designs these days. But in any case, if you have the ability to adjust the height of your lumbar support, sometimes it's actually adjusting the height of the entire backrest and then in that case, you know that the backrest is at the proper height when you find that aha moment where you have that nice snug fit, there's no gap, and your low back is nice and compressed against your backrest. Then you want to take care of your armrests. So We want to have our arms in neutral posture, and a common issue with computer work is that we elevate our shoulders because sometimes the desk is too high. We don't want, or the armrests are too high. So we don't want that. We want to be able to start off with our shoulders in their neutral position, which is set back and down, and then our elbows at about a 90-degree angle. And then you bring your armrests in to accommodate your neutral position. So note too that my elbows are rested at my body sides. They're not out too far to the side. They're actually rested at my body sides. So in this position, this is the position where the least amount of stress and strain is placed on our tissues, and blood is able to flow properly through the tissues. So we want to be able to get the armrests to come in to where our neutral position is. Okay, so this is the position where the least amount of stress and strain will occur on any of our particular tissues. Using the armrest where the forearms can actually settle onto the armrests without being too high to elevate the shoulder, without also being too low where there's just really no support when you're typing or mousing. When they settle nicely onto the armrest, that allows freedom for your neck and shoulder muscles to be able to relax, and therefore you have better blood flow through those tissues, and it reduces the risk of fatigue and chronic wear and tear on those tissues. All right, so this is neutral sitting posture for me. But again, you know, we all come in different shapes and sizes, so one chair doesn't fit all. There's lots of different adjustment features available on chairs. Those are the main features and probably the more important ones to look for. So with that said, we've been sat in our chair now for quite a period of time. So I'm just going to encourage everybody that if you haven't already stood up during this presentation, to stand up and shake out your legs, shake out your arms, move around a little bit, and get the blood flowing back to your extremities. Okay. So the next posture is standing posture, and that's nicely depicted on the presentation slide here. Essentially what it is that you are able to draw a straight line right down through the body from right to left and front to back. Okay, so your ears are over your shoulders, which are over your elbows, over your hips, over your knees, over your ankles. And this is important because we are now seeing in workplaces the introduction of sit-stand workstations. We're seeing them, they're fairly popular now, which are a great addition if they're used properly, and if they're used, period, I guess we should say. And what I mean by that, I guess, in regards to standing posture is that when we are at a standing workstation, we need to be making sure that we have equal weight distribution across both sides of our body. So we should not be leaning our body weight into one hip. That interferes with the shape of our spine, and also then all the soft tissues that branch off of the spine. And that can cause some wear and tear over time. So if you find that you're standing and you start to get fatigued and you're shifting around, starting to place your weight onto one hip, moving around a lot, is probably a sign that you've been stood too long and you need to sit. Okay, and there's not one hard fast rule that you should sit for a period of time or stand for a period of time. There are some general guidelines, which I'm going to refer to now shortly. But what we need to understand is that we're all individuals, and for you may be able to tolerate standing for 20 minutes or 30 or 40 minutes without any discomfort, and you feel good and you find it really, really helpful. For others, due to particular, personal factors, maybe medical or physical limitations, previous injuries, what have you, maybe you can only tolerate standing for 5 or 10 minutes at a time. Whatever it is that makes you remain comfortable is what you should follow. So listen to your body and just use that as a guideline, that if you are starting to lean into one hip or rest your arms onto your desk maybe your back is feeling a little tired, then that's a sign that you've probably been standing too long. When you're standing or you're sitting, The key is that you want to have some just minor engagement of your core muscles. And your core muscles are the muscles that are shown in red here. And so basically it's your abdomen, your back, your buttocks muscles, your thigh muscles. You want to be able to have some engagement of those muscles because these muscles are designed to actually stop movement, and they help to protect your spine. They help to allow you to be able to maintain neutral posture of your spine and keep yourself in a nice upright posture, whether you're seated or standing, so that you're not going to change that S-shaped curvature. You want to be able to maintain the S-shaped curvature. So by engagement of your core muscles, what I'm referring to is there's two analogies. One is that just imagine you're about to blow up a balloon. Okay, so you can actually kind of follow this as I describe it. So you purse your lips and then you start to blow out of a balloon or blow into a balloon. And when you do that action of exhaling into a balloon, you can feel some firmness in your core. And that means that now your core is actually engaged. Okay, the muscles around the trunk they're actually engaged now. And that's how it should feel when you're sitting or standing. However, when you're sitting or standing, you shouldn't need to have too intense of a contraction there of tightness of your muscles. It's just a slight bit of firmness to be able to allow you to keep in that nice upright supported posture so that you don't slump forward in your chair or standing at your desk. Sorry, back up for a moment. The other analogy is that you can imagine if someone was about to hit you in the belly, and your instinct would be that you firm up your belly area so that you can protect your organs. And that firming up is, again, what you would feel when you should be, engaging your core when you're sitting or standing, except that firmness from protecting yourself from being hit in the belly is way more intense than what's necessary for sitting or standing. So there should just be a light bit of engagement of your core muscles, and you should be able to just breathe naturally. The key with this is that you're not changing the shape of your belly at all. You're not sucking in your belly at all. There's just simply some firmness, some tightness in those muscles. And it should just be light. Okay, so the second prevention measure that we want to discuss today is workspace improvements. So what are some ergonomic tips for setting up a home office or setting up a workstation if you're in a hotel environment or if you're working from your vehicle or even if you're in the office and you just don't have a chair that allows you to get in neutral posture? What are some things that you can do? Well, first and foremost, if it is a home office environment that you're working in, the home office should meet the same health and safety requirements as those available at work where possible. If you are someone who is assigned or I guess required to work at home indefinitely, we are now a couple of years into the pandemic, 3 years into the pandemic, and it's no longer acceptable to have a temporary workstation. Workers should not be working with unsuitable furniture and equipment. So at this point in time, if you're required to work from home indefinitely or for a prolonged period of time, it is your employer's responsibility to provide you suitable equipment so that you're able to work healthy and safe. And that means being able to work in a neutral posture so that your back is supported, your neck and shoulders are supported, your elbows are supported, your arms, everything is supported. Having said that, some workplaces have adopted a hybrid model or have given workers the option to be able to work from home or from the office. And the requirements are a little different in that case, in that, if you have the ability and the employer has provided you with a suitable workstation in the office, they're not required to provide you with that equipment at home if it is your personal choice to work from home. They have to provide suitable equipment somewhere, and so if they allow you to be able to come in the office and use that equipment, well then they have met their legislative requirements. But it would be the employer still has a responsibility to ensure that any equipment the worker is providing for themselves is suitable equipment if they're allowing them to work in the home setting. So they do need to do their due diligence and make sure that workers have are set up with the appropriate equipment. So perhaps they send in pictures or have an assessment done in the home environment to be, or send in pictures to have reviewed. At a bare minimum, and what I'm talking about here is maybe if you're working in a temporary place for just a short period of time, there are some things that we can do to better set ourselves up more ergonomically. So at a bare minimum, have a hard and flat work surface that allows you to be able to work with the work surface at elbow height. So if you can adjust the height of your chair to accommodate the height of the desk so that the elbow, the armrests are at the height of your desk, that is ideal. Essentially, once you've adjusted your armrests for a neutral posture for you, you shouldn't need to adjust the height of the armrests then when you come to your desk. You should, you know, if there's a mismatch, you should adjust the height of your seat pan or the height of your desk. You want to have a chair that accommodates neutral posture. I'll show you a couple tricks now shortly on some things you can do temporarily. An external keyboard and mouse would be ideal because with the laptop, if you're working with your elbows at a 90-degree angle so that the keyboard is at your elbow height, well then most likely your neck is impacted and you have quite a bent neck to be able to see the monitor. So ideally you would raise your laptop on it could be a stack of books or a stack of board games or what have you, and then you would adjust the height of the monitor so that you're able to have your neck in a nice neutral posture, a nice upright posture, not bent forward, not bent back, and then you have that external keyboard and mouse at elbow height. Appropriate lighting, and so that you don't have glare on the screen. So a key piece there would be not having your monitor such that glare from a window that's behind you is shining sunlight onto your computer screen. That would be a no-no. Ideally, what you would do is position your monitor perpendicular to a window in an area in which you're working. Okay, so if you have a window in your area of work, then position your monitor perpendicular to it to help avoid glare. Noise levels controlled and comfortable temperature, because if we work and we're too cold, or on the other side of it, if we are just too warm, both of those situations can cause us to fatigue more quickly and can also impact our posture. So this is a picture of what I done at the very beginning of the pandemic. I'm a field worker, so at any given day I have my laptop with me, and when our workers were sent home and advised not to come into the office at the beginning of the pandemic, all I had at the time was just my laptop. Was my laptop and keyboard and mouse, because I'll always have these external devices. But I didn't have a chair provided for the short period of time. And in regards to a desk, I didn't have a suitable height desk for me to work at. My kitchen table was a high table. It was just too high for me. So I made a few adjustments. I used a craft table to get a more suitable height. The only chair that I had available to sit on was my kitchen table chair, which are high chairs. And that, of course, would not allow my feet to be able to be firmly supported onto the floor. So I made a footstool. I didn't have any arm support, but for the time being, it was a very temporary period of time before my equipment was provided for me. My chair was provided for me, but for the time being, I just made sure that I was at the proper height in relation to my desk, so that my elbows were at the height of the desk. And then I provided back support by rolling up a towel behind my back and putting it in my lumbar spine there so that my lumbar spine could be maintained, curvature could be maintained. And then I raised my laptop so that the monitor was able to allow me to keep my neck straight. So those are a couple of tips or suggestions if you are forced to have to work temporarily in a just a temporary remote location or a location that you don't typically work at and you don't have the ideal equipment. And what I also did to give myself a postural change was I set up a standing station at my kitchen counter. I raised the laptop once again, but in this case, I was more restricted with the height due to the height of my cupboards. I wasn't able to have my monitor quite as high as I should, but in any case, I felt like there was more benefit in being able to change up my sitting posture and just stand for a short period of time with just a slight bend in my neck, a very slight bend in my neck. It wasn't that bad at all. And it worked out that the countertop was at my elbow height anyway, so my wrists were able to be straight. Okay, the next prevention tip is organization of work. And if you work from home, it can be difficult to separate your work and your home life, but keeping a workday ritual is important to help balance life and minimize spending extra time in a sustained or an awkward posture. So a couple of tips would be to have a specific location designated for work, the same room or the same corner of a room. It's a place where you associate it with just work. And begin and finish at the same time every day. Have a beginning and end of day ritual. Some people find it helpful to leave the house and go for a walk before they start work. And you might want to do that at the end of the day as well. Changing up your clothes is another idea. Changing your clothes at the end of your workday may also help you with psychologically being able to separate work life from home life. Schedule breaks during the workday to stretch and eat as appropriate. And as you would for working in the office, set a schedule and stick to it. Make a to-do list and check your accomplishments throughout and at the end of the day. Minimize distractions as best you can so that you can work more efficiently. Determine what interruptions are okay and what's not. Tell your friends and family, for example, what your ground rules are so that you can be focused and you can get your work done efficiently. And address any work scheduling or workload issues as well with your supervisor. Be careful not to overwork. In an office environment, there's often natural breaks that will occur, but this is not always the case at home. So discussions with coworkers or a quick walk to the printer, we don't have those abilities when we are in the home quite the same. So we need to be making sure that we are scheduling in and really planning for changes in body position throughout the day. Extended hours in the same body position or repeated motions can lead to various MSIs. And examine your work habits and activities to ensure you're avoiding awkward postures and not staying in one place too long. Perhaps set a timer to get up every 20 minutes. And alternate your tasks to change posture and use different muscle groups. Okay, avoid working for too long on one task that requires you to be in the same position or the same posture. And at the end of the day, put your work away. Okay, and you can work with your employer as well on finding ways to prevent MSI in these types of work environments. So some guidelines in regards to when you should change posture or change it up is that after 20 to 30 minutes of sitting, we should stand and move around, or at least change to a standing posture if you have the ability to use a sit-stand workstation or even a fixed standing station. And in regards to standing, the key to preventing discomfort in the back is to stand no more than, actually less than 45-minute intervals based on research that has been done. But again, there's individual variances there, so you listen to your own body, and if you start to feel discomfort or fatigue, then change your posture. In any given case, you want to be able to get movement throughout your body for at least a few minutes every single hour. Because if you just go from sitting to standing and do the same kind of work, your neck and shoulder and upper back muscles to do computer work, for example, are still being used. Those muscles are still being activated and used, whether you're sitting or standing. So you do need to be able to take some time away from your workstation to allow those tissues to get the rest needed. You can set some reminders on your phone, for example, if you are not used to having regular changes in posture until your body is more used to it. And the next suggestion or prevention measure would be to conduct tension breaker stretches periodically throughout the day. But one safety note is that if you do have medical conditions, you should always consult with a healthcare professional before starting any physical exercise program. So that's just a little disclaimer before we start, before I start to show you some stretches that you could use to help alleviate some tension in your body. So I'm going to walk you through now. I'm going to bear with me, just turn on the camera and walk you through a couple of techniques of stretches that can be performed to help alleviate symptoms in the neck and shoulder and upper back area. And I'm just going to focus on these for today. However, if I have a resource for other parts of the body and some tension breaker stretches that can be performed, and if you're interested in that resource, you can email safety@workplacenl.ca and a copy of the resource will be sent out to you. So bear with me as I just make an adjustment to the desk to raise the camera. Okay. All right, so in regards to the neck, one that you can do is called a chin tuck. So what you're doing is standing in a nice neutral posture, your shoulders set back and down, and now you're going, perhaps you can use 2 fingers and sort of put it on your chin to help guide you. You're going to bring your chin back towards, if you can imagine a wall behind you, you want to have your head touch that wall. Okay, so your chin is tucked back, and you can hold that for 5 seconds or so, or 10, 15 seconds or so, and then relax, and then do another chin tuck, relax, another chin tuck. Okay, and maybe you repeat this 3 times or as many times as you feel you need, depending on your level of discomfort. Another one you can do is a neck rotation where you look over one shoulder and you can hold that for a period of time. And you can take it a step further to help stretch your scalene muscles by looking down. So basically your neck is rotated about 45 degrees and then you look down as if you're about to look down at your knee and hold that stretch. And then, of course, you would repeat that with the other side. Rotate to the other side. Another one you can do with your neck is have your ear come down towards your shoulder. And you can hold that for 15 or 20 seconds or so. Bring yourself back up to neutral position and alternate sides. Okay, so that's just a couple, and I'm going to also show you a chest stretch. This is a common one many people may be familiar with. So what you're doing, if you have a door frame, this may be easier, or even up against a wall, essentially what you're going to do is you're going to lean your body forward and get a stretch in your shoulder or your chest muscle, your front shoulder and your chest muscles, okay? So you're going to have your elbow bent, and your elbow is going to be slightly higher than your shoulder, and you're going to lean your body forward so that you get a stretch in the muscles in the chest. And then one for your mid-back and shoulder area would be to reach for the sky. So you're standing in a nice neutral posture and you just bring your arms over your head. Maybe you want to interlock your fingers like this and reach for the sky, reach for the sky. So it's almost like you're just stretching your spine upward. And you may want to hold that for a few seconds and then relax. And you can repeat that a few times. You can also bend to one side, come back to neutral, and bend to one side. Okay, so that's just a few that I'm demonstrating today, but I have a number of other exercises, again, in that resource, which you can request by emailing safety@workplacenl.ca. Turn the camera back off. All right, and the last prevention measure that I'm going to discuss is diaphragmatic or belly breathing. Okay, so this is important because it helps to release physical tension since it takes stress off of the neck muscles. It helps release stress tension too for improved mental focus and clarity. So perhaps for this activity, you can consciously follow what I'm about to explain as I describe the exercise. So sit comfortably with your knees bent and your shoulders, head, and neck relaxed. Place one hand on your upper chest and the other hand just below your rib cage. This will allow you to feel your diaphragm move as you breathe. Breathe in slowly through your nose so that your stomach moves out against your hand. The hand on your chest should remain as still as possible. Tighten your stomach muscles so that your stomach moves back in as you exhale through pursed lips. The hand on your upper chest should remain as still as possible. And now we will just do that a couple more times. Breathe in slowly through your nose so that your stomach moves out against your hand, and the hand on your chest should remain as still as possible. Then tighten your stomach muscles so that your stomach moves back in as you exhale through pursed lips. And the hand on your upper chest should remain as still as possible. What this is doing is actually allowing you to be able to use your diaphragm properly while you're breathing. And this offers several benefits to your body, including lowering blood pressure and heart rate and improving relaxation to clear the mind, relax the body, and improve focus. When we are tensed, when we are under time crunches, we experience a lot of physical tension in the neck and shoulder region, and this activity can help us to release some of that tension. Okay, so now I'm going to just show you a couple of resources that we have available on our website. This is the sitting position safety share I discussed earlier. We also have a video on how to adjust your chair. It's 3 minutes in length, called Ergonomics, Adjusting Your Chair. We have a standing position safety share to describe how to stand in a neutral posture and some tips on how to adjust your workstation to allow for that. We also have a resource on adjustable sit-stand workstations. It's a guide for employers in regards to purchasing these, and a guide for workers in regards to how to use them in a proper manner. We also have ergonomic solutions for a temporary home office or any remote location, a safety share on that, and the use of laptops. And we have a safety share specific on the tips for improved laptop setup. And this is the resource I was referring to, tension breaker stretches, that it is not currently available on our website. However, you can access via email, emailing your request to safety@workplacenl.ca. And also there's another resource that you could request via the same email address, called postural exercises. These are exercises that you would use to improve the functioning and stability of the joints, typically impacted by prolonged and poor sitting posture. These exercises are ones that you would not typically perform in the work environment, but it's more so for at home to help condition the particular muscles and tissues required to use neutral posture. So that's it for today. I just want to mention again, the learning objectives for today was to discuss pandemic posture and the MSI risk factors, which are primarily awkward postures, sustained postures, and repetitive motions. We talked about the signs and symptoms of musculoskeletal injury related to this type of work, and we talked about a number of prevention tips to prevent damage, but also to alleviate any discomfort that you may currently be experiencing. I want to thank you for your time today. And if you have any questions or would like to reach out, I can be accessed at Cheryllee.Osborne, spelled CHERYLEE.Osborne, OSBORNE, at workplacenl.ca, or at 778-1124. Thank you.